My name is Sherry Guess, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware, diet, and environments. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome to the jungle. Today we have a truly special episode that delves into the intricate web of health, immunity, and the often overlooked interplay between systemic metal allergies and chronic infections. I'm Sherry Guest, your tour guide, thrilled to be joined by the BetterHealthGuy Scott Forsgren, who is a seasoned survivor of Lyme disease and mold illness. Scott is a dedicated advocate for recovery, detoxing, nutrition, all the things. Scott, welcome to the show, and thank you for being with us today.
Thank you so much for having me. It's an honor.
As we dive into today's discussion, we're going to explore how chronic infections, often associated with conditions like Lyme disease, mold illness, can act as significant players in the realm of systemic metal allergies. It's a perspective that may not have crossed your mind, but as you'll discover, it's a critical piece of the puzzle. A few weeks ago, Scott and I discussed on his BetterHealthGuy podcast how metal allergies need to be considered by patients on their journey to recover from Lyme disease, mold illness, and other chronic infections. Today is a continuation of that conversation by discussing how these pathogens need to be part of the conversation between metal allergic patients and considered as a crucial component in our recovery process. So let's get into it. Scott, tell us about you.
I was working in Silicon Valley in the software development industry, and less than a couple of years after starting that, my health really fell apart. And it was over the course of a weekend. I had a tick bite several months prior, but didn't connect the dots that Lyme disease may have been a significant part of the puzzle until 8 years later. So the tick bite was in 1996. It's been a long time. Several months later in 1997, everything just kind of fell apart. It seemed like a flu times 100. My symptoms were so bad over the next several months that I not only had never experienced anything like it, but I didn't know if I would survive it. And there were certainly times where that was okay. Definitely was a very scary, frightening time. And we just didn't have the same information that we do today. Probably my worst symptom was head to toe burning sensations, just like you had almost a chemical burn or a sunburn all over my body around the clock. I couldn't walk across the room without feeling like I had exerted the energy allotment for the day. I had lots of balance issues, like sitting up in a chair. I always felt like I was falling off the chair, or I would prop myself up at night in bed with pillows because I felt like I was going to roll onto the floor. And so from 1997 to 2005, I went to 45 doctors, neurology, infectious disease, all kinds of different practitioners, got lots of referrals to psychiatrists. That was a fun experience. And so
been there.
Pretty much, yeah, it's just crazy, the gaslighting. And so pretty much every imaginable symptom, I mean, the difficulty walking, balance issues, lots of visual stuff, blurry vision, floaters, lines, squiggles. I had a low-grade fever that lasted for a long period of time, joint pain, nausea, lots of gastrointestinal problems, cognitive issues, memory loss. I remember one time sitting in the back seat of the car and then thinking, well, how am I going to get somewhere? I wasn't even in the driver's seat where I needed to be. Just crazy things like that, not remembering your phone number that you've had for years, numbness and tingling, kind of this motor-like tapping sensation, the idling of a car sensation, tremors, fasciculations, internal vibrations, crawling sensations, light, sound sensitivity, anxiety, depression, OCD, high resting heart rate, heart palpitations, just so many crazy things that you're like, what in the world is going on? Most of those practitioners that I saw during that 8-year period suggested that it was all in my head. I did get a diagnosis of chronic fatigue syndrome. I did get a diagnosis of fibromyalgia. It was strongly suggested that it could be multiple sclerosis, and so we explored that as well. But back then, you couldn't find a lot online. If you found anything about chronic fatigue syndrome, it was, well, most people get better in a decade. And so for me, at that time, being a type A plus personality, the idea of like, well, let's wait and see for 10 years, like, no, that didn't sound like a good plan. So fortunately, in 2005, a new medical doctor thought, well, all of your problems must be food allergies. So I'm going to send you to this lady that works at an outlet mall. She does electrodermal screening, which is an energetic system of testing. Go find out what foods you should avoid and you should be better. And that lady was really kind of an inflection point for me, where she was the one, after spending a couple hours together, that suggested, go get your doctor to test you for Lyme, for Borrelia, for Bartonella, for Babesia, for Ehrlichia. And I didn't really take it that seriously. I thought it was all a little too crazy for me at the time. But she really urged me to take it seriously, that it was a serious situation. And so I did. I went and got tested. We were able to confirm all of those things with blood tests. I think we had to repeat a couple of them because testing is not perfect. But that was also what got me to be very interested in the whole idea of energetic testing in the Dietrich Klinghardt arena. And he's now been my primary mentor for many, many years. I remember January 2006, after I was diagnosed July 2005 with Lyme, sitting in the front row at his conference. And I'm sure he was tired of seeing my hand go up as many times as it did. Fortunately, today, I'm doing really well. I still take great care of myself. I still take supplements. I still do things to support my health. I think that really was and is a message of the chronic illness in the first place, that we need to prioritize ourselves. I really do feel blessed to be in the place that I am today with a very active and productive life. I left the corporate world 7 years ago to focus full-time on this arena. It's what I feel passionate about. It's what I wake up and just feel such joy to be able to participate in this conversation, in this realm, in this community, doing the podcast, coaching clients, doing work in the energetic realm. The FDN-P that you asked about is a health coaching functional practitioner program called Functional Diagnostic Nutrition. And that really is a very holistic way of approaching health using what we call DRESS principles, which is diet, rest, exercise, stress reduction, and supplementation. It teaches you a bit about how to use functional labs and things like that to look at maybe a lot of the things that conventional medicine might be missing when we're talking about more chronic illnesses. I started BetterHealthGuy.com in 2005. I did not know that I had Lyme disease. I started it as more of a something's wrong with me. I'm going to put out what I've learned. Hopefully someone's going to reach out and enlighten me and come to some solution. So I think it was about 3 months after I launched the site that finally the Lyme disease piece became part of my understanding. Podcast started in 2016. When I started the site, we knew very little about Lyme disease. I knew nothing about mold illness. I didn't have really any of the understanding of root causes of what was happening with me at that point, what was driving these chronic fatigue syndrome and fibromyalgia diagnoses. I spent some time kind of chasing parasites with a practitioner that was very famous at the time and was actually very good, chasing some of the Epstein-Barr viruses and things like that. And I did improve for a period of time and then subsequently had a significant relapse. I was chasing lots of different things. It did take some time to get the Lyme diagnosis. And then that was just one other piece of a bigger puzzle. I think people think of me as the Lyme disease guy. And the reality is there's so many pieces of this puzzle. I would say probably the mold piece maybe was even larger than the Lyme disease piece. And we'll talk about that. So like I said, back then, very little information about Lyme disease that you could find. I don't think Google even existed then. I think it was a couple years later before that came out. I think today we kind of have the opposite problem that there's like information overload, and then it's trying to figure out, okay, which information should I look at and what might be helpful for me. I think fortunately today there are more experts in this realm. I don't think it has to take as long for people to get a diagnosis today as it did when I started this journey in 1997. On the other hand, I think the factors in our world that contribute to complex chronic illness are also increasing over that period of time. Years ago, maybe somebody would say, well, stop eating gluten and magically you'd feel significantly better. I don't think that's the case anymore. It's usually not one thing. It's usually lots of different things. I think there is more research being done today than I've ever seen since I've been chronically ill. I think there's more tools, more treatments, more modalities. And so I do think it's a hopeful time. And I'm also intrigued by the fact that there are so many similarities between chronic Lyme disease, chronic fatigue syndrome, now long or chronic COVID. And I think that's also bringing more attention to these chronic conditions where most of us had been gaslit for so many years, didn't have good solutions. The few practitioners that we could find that were willing to try to be part of the solution were also often attacked, and lots of politics around that. But I think now it's front and center. And I think that as we better understand COVID, a lot of that is going to apply to many of these other chronic conditions as well.
I'm excited to see metal hypersensitivity that's systemic entering into this realm. It's like the early stages of Lyme disease. It was so fringe. Now we're finding that this vast umbrella of immune dysfunction and the root causes are so much more common than we think. Many of my followers are aware of hypersensitivity to metals, and many of them are in various stages of diagnosis, some that have implanted hardware, some without, some with lots of knowledge, and some with very little. So I'm excited to explore with you today the subject of Lyme, tick-borne infections, chronic infections as a byproduct of the type 4 metal allergies and immune dysfunction. But before we get into this, I'm just going to take a minute and briefly explain the role, if you don't mind, of a compromised immune system in allowing chronic infections to take hold. And then I'm going to let you expand on these concepts. So as a high-level overview, a type 4 delayed hypersensitivity reaction involves the body's immune system responding to certain triggers, such as metals, through a specific mechanism that is mediated by T cells and driven by antigens. Now, when chronic infections like Lyme disease or mold illness enter the picture, they can act as accomplices, so to speak. The immune system is a complex network, and when it's already sensitized by the hypersensitivity reaction, it becomes more vigilant, and chronic infections, often caused by persistent viruses or pathogens, become additional stimuli for the immune system. So when the immune system is compromised, perhaps, as in my case, due to the ongoing hypersensitivity reaction or other factors, it creates an environment where these infections find it easier to take hold. In someone with a fully functioning immune system that's healthy, these infections might exist at a lower chronic level without causing any noticeable issues whatsoever. However, when the immune system is compromised, either by a hypersensitivity reaction or by other factors, then these infections can activate, so to speak, and become much more symptomatic and problematic. So it's like a domino effect, with the body's defense mechanisms interplaying in ways that have far-reaching effects and consequences. And so this is what we're going to be exploring further in today's discussion. Scott, would you like to expand on this a little?
I think we have a significant problem with immune dysregulation in these complex chronic illnesses, and even more so now with COVID and the COVID era. I think once the immune system is dysregulated, that can then be the source of many of our symptoms, what we feel as our condition or our dis-ease, our inability to manage other things in the body like chronic infections. I think that could be COVID as a significant immune dysregulator, where a lot of other things, maybe Bartonella or EBV or mycoplasma or something, then emerge, creating your long COVID. I think that mold exposure, mycotoxin exposure, we'll talk more about that. I think that can be a significant dysregulator of the immune system. Maybe someone had a tick bite 30 years ago. They never identified as being sick. They move into a moldy house and now they have chronic Lyme disease because their immune system became dysregulated and thus they could no longer manage these infections. And a lot of the type 4 hypersensitivity reactions I'm learning about from you, but I think this is another area where any immune dysregulation is going to make it more difficult for the immune system to do what it should be doing in support of our health, managing these chronic infections. And so the environment that we live in, work in, go to school in, drive around in, those can all be major triggers for immune dysregulation. I think mold illness is a significant piece of this conversation, but it's multifactorial, and we're going to get into more of those details. And so I think much of the focus in getting out of these conditions, in my opinion, is about immune modulation, immune regulation, calming the system, creating tolerance and integration with our microbiome, with our bugs, taking that burden off of the immune system and getting back to the blueprint of health that we all have within us.
So good. I know you've studied quite a bit regarding the relationship to metal toxicity in regards to chronic infections. What personal experiences, if any, do you have in the realm of metal allergies?
Dr. Klinghardt has been my primary mentor around heavy metals and the impact they have on illness. We know that, for example, aluminum can be the main driver of Lyme disease and how serious your Lyme presentation is. We know that our environment is now more toxic than ever. I was first introduced to the concept of metal hypersensitivity, metal allergy, probably 2006, and that was in my early mentoring with Dr. Klinghardt. I later had the opportunity to briefly connect with Dr. Vera Steshkol, who was the original creator of the ELISA testing. And so I was aware of it, but until we had our recent conversation, it was really the first time within my community that we really highlighted this and the importance of it. And I think people are going to really benefit from that conversation. So I think today we tend to think of metals more as toxigenic, but I think we also think of them as triggers for mast cell activation, and probably then the metal allergy piece overlaps with the mast cell activation piece as well. So from my perspective, the metal toxicity and metal allergy are very related. The more toxic you are, the more metals you have in your body, the more of a problem the allergy piece becomes, the more symptoms of toxicity then that will drive. So we ideally want to gently reduce the metal in our body as well. Now, if you have an implanted metal object, then obviously your experience, you ideally want to get that removed. But if we're talking just in general, like metals, chronic metal toxicity, ideally we want to try to minimize the burden of metals in the body that then indirectly will also help to reduce some of that metal hypersensitivity as well. You could also have someone that isn't allergic, but is still highly toxic. And you could certainly have someone who maybe didn't have a high level of metal toxicity, but still had metal hypersensitivity that was significant. So I think we really have to look at both pieces. We talked about a lot of those in our recent conversation where I had the pleasure of interviewing you. I don't know that metal allergy played a significant role in my own health, but this has been many, many years and probably not something that we deeply considered. I feel like there was a time that I did some of the ELISA testing many years ago, but this is back when I had multiple 12-inch binders on paper before the digital era. I couldn't actually find it to say for sure, but I think this whole concept is just so critical, and you're bringing awareness to another piece of the puzzle that I really need to also bring more attention to in the people that I'm working with.
That is the hope. It takes a village, right?
How would someone who is just starting to look into the role of chronic infections diagnose them so they could know what additional burdens their immune system might be struggling with? Like, what testing have you found to be the most effective for Lyme, co-infections, and mold illness? Are there any that are reliable, or do you agree with experts like Dr. Horowitz, who introduced the MSIDS model? For the listeners who don't know, that's the multiple systemic infectious disease syndrome is what MSIDS stands for. And his thoughts that diagnosis is more of a clinical picture.
So Lyme is a clinical diagnosis. Yes, it does not require a positive test for the doctor to diagnose you with Lyme disease. I think testing has gotten significantly better over the last 5 years or so. We have new tools available. We're not talking with any of these conditions about black and white. We're talking about shades of gray. I would say the labs that I most commonly think of in the Lyme and co-infection testing arena are IGeneX, Armin Labs, which is in Germany, Infecto Labs, DNA Connections, and Vibrant. Those are probably the more popular, more discussed. Interestingly, now some of these are looking at T-cell responses with ELISpot testing as well. That's going to be Armin Labs, Infecto Labs. I believe IGeneX also does some of that. A little different than Melisa, but it's an interesting shift because if we're looking more at T cells, we get a little bit more of a perspective of what's happening over the past 8 to 12 weeks rather than, oh, look, I have an IgG response. And what does that mean? That could have been something I had 2 years ago. Is it a problem now? Is it not? So I think these are also some very helpful advances. And then mold is a whole separate conversation. And at the same time, there is still a lot of gray.
I will link to all of these testing modalities in the show notes. There is a really valuable do-it-yourself questionnaire on cangetbetter.com. That's Dr. Richard Horowitz, who is an internal medicine doctor renowned for his work in Lyme and chronic infections and chronic diseases. That's a free online survey that you can fill out and you score yourself. It will tell you if you are suspect for Lyme and co-infections. And it's really good in helping hone in that clinical diagnosis, so to speak.
And similar to that questionnaire that Dr. Horowitz created, Dr. Jill Krista has taken that concept and adapted it to the mold illness arena. And so in her book, potentially on her website as well, there's a similar kind of questionnaire where you can get a sense for the possibility that mold is driving some of your symptoms as well. So between those two, I think that's great. Armin Labs has a similar questionnaire. Some of the other companies, Cellcore, for example, they have a questionnaire as well. The one that Armin Labs has, you can go through and put a lot of your symptoms, and then it will give you some suggestions as to which infections are more likely. If you're trying to limit the testing that you're doing and limit the expense, you potentially could get that insight and then use that in making decisions about what tests to potentially order.
Oh, fun things to play with. I'm going to deviate for just a minute. You and I have talked, and one of the tools I used before I went to LymeStop for my treatment, if you've heard my episodes, is something called a Rife machine. It's basically a device that delivers frequencies into the body that target specific pathogens. And I have been able to use that as a testing modality, so to speak, for Lyme and co-infections. Basically, you send the frequencies that agitate the Lyme cells into the body. And if you have what's known in the Lyme community as a Herxheimer reaction or a die-off reaction, it's an increase in your symptoms in a short period of time following that, you can pretty much assume that you've got some of that bacteria in your body. And that's been a free test if you have that equipment. And I assume you could probably do that with herbal treatment or antibiotics and just monitor the response of the body in response to the treatment as a pseudo diagnosis.
It is something that can be done with herbs. I would say I probably first learned about that from Dr. Neil Nathan, Dr. Wayne Anderson, Dr. Eric Gordon. They were using herbs in what we call a provocation test, which is very similar to what you were just talking about. Sometimes the challenge can be a positive provocation is you feel significantly better, and other times you feel significantly worse. So either of those changes could still be very relevant in telling you, yeah, this might be an area to explore further.
Assuming that chronic infections and conditions show up in the testing or in our questionnaire, how much doom and gloom does one let in surrounding those? And you and I both know that there are a ton of horror stories on the internet. Is recovery and hope for a better quality of life possible?
We all have more microbes in us and on us than we do have human cells. So the idea that we maybe have one chronic infection, it's probably not realistic. We have more microbes in us and on us than we do have human cells. And so we literally are a bug bus or a bag of bugs, so to speak. I don't think we will ever eradicate every Borrelia, every Bartonella, every Babesia in our system. But I think that's very empowering, because otherwise, if we have to do that to get well, it seems impossible. It's okay that we have some of these chronic infections. These infections are often, to your earlier point, secondary to other factors like our external environment, like our mold exposures, like immune dysregulation. I think recovery is absolutely possible. I am really well today. I exercise at least a couple times a day. I work way too many hours. I have a really productive life. Do I still have some chronic infections? If I had to bet money, I'm sure they're still there. Do they still significantly impact me? No. I think we have more reasons now than ever to be hopeful that we can improve our health, that we can have a better quality of life. At the same time, if you have the kinds of conditions that Sherry and I are talking about, and you are looking for solutions in the conventional medicine model, you probably aren't going to get to the place that you would like.
1,000% agree. Although there's hope, they're coming along. But speaking to that point, gaslighting by many in the medical communities has been and really still is a thing. And it's a real challenge. So as medicine advances and narratives change, we've already talked a little bit about it, but I think the COVID pandemic brought more understanding and validation in the professional sectors to the concept of these long haul symptoms and syndromes, and the fact that they're real and they can cause real significant disability and symptoms. Are patients beginning to get more grace and understanding and support from providers here? And do you think that advances in understanding and protocols will continue to be pursued by mainstream medicine?
I think if someone's trying to get their answers from the acute care medical model, they probably are more likely to be gaslit. If you're reaching out from the beginning to practitioners that are Lyme literate or mold literate and reaching out to groups like ILADS or ICI, which is the International Society for Environmentally Acquired Illness, and you're using their practitioner locators to find someone that can help you, I think you are much more likely to be heard, to be validated, to find solutions. I do think that long COVID, I keep hearing one of my colleagues saying it's chronic COVID, because from some practitioners' perspectives, there may still be some virus, kind of like Epstein-Barr virus, that's just kind of still there brewing in the background. But I do think that long COVID ultimately may be a bigger issue than even chronic Lyme disease in terms of the number of people that are impacted, in terms of the public attention, the awareness, the research, lots of good things coming from a very stressful, difficult pandemic time for many of us. I'm not sure that these conditions will ever be fully embraced by mainstream medicine. They're such different paradigms. I would like to think that's the case. Maybe as we move into more computer-based AI and those kinds of things, which obviously are scary in some ways as well, that might then enlighten some of mainstream medicine. Depending on what you read, I've read as many as 9 million people in the US may already be dealing with long COVID. Some articles suggest 2 million with what they term post-treatment Lyme disease syndrome, which is probably not what you're going to hear most Lyme literate practitioners call it. They're going to say, well, that's still probably chronic infection. We're talking about millions of people that are dealing with these conditions that need better tools, better treatments, better support, better practitioners. And fortunately, I think chronic COVID or long COVID is a catalyst that is very rapidly moving us in that direction.
Assuming that for my listeners, a potential root cause of metal hypersensitivity has been uncovered, and then now we've introduced the possibility of confirmed chronic infections and or a mold component, it can be, I'm assuming for them, mind-blowing and overwhelming because it was for me. Where does one start? Is it more important to treat the bacteria, virus, and fungus, parasite, pathogen, or is it important to nurture the immune system and body as a whole?
So that is the perfect segue into this 11-step model that's emerged from all of my mentors over the years. And so maybe we just jump into that and we'll walk through those steps that'll give people a little bit of a picture. Interestingly, I think people will be surprised as we go through it that the focus on the microbe is very, very late in this process. In my 11 steps, it's actually step 9. Most type A personalities want to start step 1 with killing something. And if I can just kill it all, I'm going to be better. In my experience, that's not the case. Before we get into step 1, I'll just give an overview of what the 11 steps are. I would say first, my understanding of this model of recovery is really so much credit to incredible mentors like Dietrich Klinghardt, Neil Nathan, Jill Krista, Amy Dirksen, Simon Yu, Raj Patel. Very little of this is original thought. One thing that I think I'm relatively good at is learning from the brilliant people and then trying to figure out how to put those puzzle pieces together. So step 1, detox and drainage. Improving our terrain, very important, and does play a role when we're talking about metal hypersensitivity. If we're not detoxifying, we're not getting some of these things out of the system, we're more likely to have ongoing metal allergy. Step 2 is improving the external environment. The world around us is important. Are we getting mold exposure? Are we getting EMF exposure? Our internal terrain is probably only ever going to be as healthy as our external environment. Step 3 is optimizing sleep. So critical, and we'll talk about that more. Step 4 is mental and emotional health, looking at traumas and conflicts and limiting beliefs and all of those things. I separate that intentionally from step 5, which is limbic system retraining, autonomic nervous system, parasympathetic tone, because as we talked about limbic system retraining, while it can be a mental emotional trigger, it can be entirely physical. You had a mold exposure, you had a chemical exposure. It may not be mental emotional at all. Step 6 is the modulation step, so critical, thinking about the mast cells, the histamine, reducing inflammation, modulating the immune response, creating integration and tolerance. Step 7 is foundational. What about your hydration? What about your nutrition? What about the microbiome in the gut? Those are so important to think about. And lots of things we can do there. We don't want to miss any of these steps. Step 8 is more around energy production, things like the mitochondria, the adrenals, and then gets into a couple of maybe obscure areas for some people, but ones that are also important, which is cryptopyruria or KPU, also something that I learned about from Dr. Klinghardt. We've written a couple of articles on it. It was known many, many years ago, all the way back to the 1950s in the work of Abraham Hoffer in working with people with mental emotional disorders. And it also applies in Lyme disease and autism and lots of other conditions. And then the last one in step 8 is hypercoagulation. Probably something no one heard about until before the pandemic hit. And now we hear about blood clots all the time. Step 9 is getting into the microbial piece. Step 10 is the dental contribution. And step 11 is, what do I do now to repair, restore, and regenerate the body? So if we're going to dive into step 1, detoxification and drainage, I would say those are the most important aspects of recovery. We really do live in a soup of environmental toxicants that it's really unbelievable to me that anyone can be healthy in the world that we've created. Mm-hmm. And I don't think that most people would have a lot of the microbial problems like Lyme and co-infections if we didn't have a toxic terrain. Improving the terrain is the road back. That is how we regain and restore health. A lot of times we also can think about Candida, for example, or Candida and parasites. They may be present in the body because of our toxic terrain, because of heavy metals. They may actually be there to serve us in that they're holding on to or concentrating some of these heavy metals to protect us from their otherwise deleterious effects. So detoxification, we're not getting into killing yet, but detoxification, in my way of thinking, is an indirect antimicrobial strategy as well. If we clean up the terrain, then we don't need a lot of these microbes to be in our bodies. So the first step here is really reducing as many incoming toxins as possible. What are our personal care products? What are we using for scents and fragrances? Those things are toxic. What about our laundry? We need pure air, pure food, pure water, either reverse osmosis or distilled. I hope no one with a chronic illness is drinking tap water. We need to think about the potential of toxins that are being introduced into the body from breast implants, from metal implants, dental implants, orthopedic implants, those kinds of things as well. Detoxification for me is really more about binders primarily. So once we get toxins from the liver into the bile, into the gallbladder, into the small intestine, how do we minimize what's called enterohepatic recirculation of toxins? How do we make sure they get excreted out in the stool rather than reabsorbed? And so that's where detoxification is the binder piece. We are all inherently capable of detoxifying. So how do we support the drainage pathways, the liver, the kidneys, the lymphatic system, the extracellular matrix, the colon, the skin, the lungs? How do we optimize those exit routes? We need to make sure that people are pooping. If you're constipated, that's a non-starter. That needs to be addressed right out of the gate. We need to think about the gallbladder. How do we optimize bile flow? You can take lots of binders, but if you're not optimizing bile flow, if there's nothing getting into the small intestine for the binders to bind onto, then we're really not going to have an efficient use of the binders that we're taking. So supporting the bile flow, really critical. And there's lots of great binders. I would say probably the one that I've used for the longest period of time is called Takasumi Supreme. It's a carbonized bamboo. I really like a lot of the products from Cellcore. And one of the reasons that I like the binders from Cellcore and I take them personally myself every day is because they're more forgiving. You can take them with food, without food, with supplements. You don't want to take them with pharmaceutical medications. But a lot of the other binders, you have to separate an hour or two away from any of the other things you're doing in terms of food, supplements, medications, things like that. We also have tools like zeolite, bentonite clay, chlorella. There's lots of things we can use in the binder realm. And then in the drainage realm, I'm generally thinking about homeopathy. So how do we support the liver, the kidneys, the lymphatic system, and critically the extracellular matrix, which is really a sponge for toxins? We need to get things through the matrix to get into cells, and we need to get toxins through the matrix to move out of the cells and eventually out of the body. So we want to make sure that that sponge is as clean as possible. Some of the more popular tools in this realm are going to be from energetics like Drainage Tone, Hepatic Tone, Hakana, Desbio. We can use UNDA numbers. We can also use herbs. I personally am more drawn to homeopathy, but you can do both. So if we're thinking about milk thistle or dandelion for the liver, or solidago for the kidneys, or red root or cleavers for the lymphatic system, for example, there are companies that just do a phenomenal job putting together herbal drainage remedies like BioRay is one that I love, their Liver Lover product, and many others. Genestra, Live Complex BioPure with their liver tincture and their lymphatic product. Nutramedix, Berberpinella, Parsley, those are great as well.
For a lot of patients with metal hypersensitivity, if you just have a contact allergy, it doesn't matter. But a lot of the plant-derived substances, especially concentrated essential oils and herbs, can be problematic. Where we have implanted hardware, the fear of pulling from that hardware and redistributing it somewhere else in the body. What do you think would be safe as far as removing metal particles from a metal allergic patient without redistribution? Would it be something like TRS?
I'm going to use part of your answer from our interview when I ask you about bentonite clay and zeolites and the fact that they are known to have heavy metals in them and whether or not that would be something you might avoid given your metal hypersensitivity. And your response was it's very individual and that you do tolerate those things. So I think it's something to consider. If someone is super metal sensitive, it's worth asking the companies for their certificates of analysis. The companies should be required to do testing for heavy metals, so they should be able to provide some of those insights. I think generally speaking, the level of metals that we're going to encounter in these things should be very, very small. At the same time, someone who's highly sensitive may still have some reaction, but there's metals in our air and our water and our food and all of these things too. So I think your point is well taken that we need to consider the potential metal content in some of these things. And you probably have a much better perspective on what of these kinds of tools people in that community may not be as well able to tolerate.
I'm going to do an episode specifically on detox. And actually, you might be a great guest to have back on that episode. I'm still just not very far distanced from my own illness and still very much in the recovery phase. I don't think I have heard for the person with implanted metal a consensus on what is safest to detox when you have implanted metal that won't pull the metal from the implant, redistribute it somewhere else, and what will safely usher it out of the body.
I'm just going to preface any of this conversation with people should talk with their doctors. We're not providing medical advice. What I say could be completely wrong for you. But most binders are really not systemically absorbed. They usually stay in the gastrointestinal tract. There are some binders that do have more systemic absorption. So I would probably think about the binders that are going to be more limited to the gut as being less likely to have a negative effect on implanted metals elsewhere in the body. We do, in some cases, need to think about whether or not certain types of binders or metal detox agents could be appropriate or not if someone has amalgams, for example. One that I have some personal reservations about. I'm not sure that I would be super aggressive using something like a cilantro tincture in someone who has metal hypersensitivity because you could mobilize things. I would also be a little cautious about sauna in people who are super metal hypersensitive, because even though you're sweating things out, you're also mobilizing things in the body that then the immune system responds to, and you can have more mast cell activation. Another helpful tool in detoxification support can be trace minerals. So a lot of times the body will hold on to heavy metals because we are trace mineral deficient. We don't have enough minerals in our foods like we did decades ago. So bringing in silica, bringing in trace minerals can actually then help the body in detoxifying and removing heavy metals. At the same time, people would want to look, because when you're getting trace minerals, there's usually 70 to 80 different trace minerals. Some of those trace minerals are going to be metals. And so whether or not then someone might react to that, but at the end of the day, there's also heavy metals in, as you pointed out, many plant-based products, but also just in plants that are grown in soil, right? Depending on the soil contamination, the air that they're grown in, whether they were hydroponic or actually out in the open, we get metals from lots of foods and things as well. Another thing I would say here that's really important is movement. We need to keep the lymphatic system going. Walking, I try to walk 4 miles a day. I know many people can't exercise, but even if your exercise is getting up and walking from your couch to your kitchen and back, and then it continues to over time expand based on what you're able to tolerate. We think we need all these extravagant lymphatic this and that and machines and whatever. But Dr. Klinghart's always been very clear that walking is probably one of the best tools that we can use for detoxification. Some adjunct things that could help: coffee enemas, very high on the top of my list, saved me so many times over the years. I think they can be tremendously helpful. Colon hydrotherapy, ionic foot baths, those can actually be helpful in the metal conversation as well, because they've been shown to help the body increase the excretion of heavy metals. Castor oil packs, oil pulling, Liver gallbladder flushes, with the caveat that I think of those as a little more aggressive. So I wouldn't do those without the supervision of someone that really knows what they're doing.
I'm interested, before we move on, to get your feedback on the ionic foot baths. I had heard they were a bunch of bunk.
I think they're not a bunch of bunk. Dr. Klinghardt has done some studies. What is maybe on the bunk side is that the color of the water matters and that all this stuff is coming out through your feet. What is probably more the reality is that you're optimizing detoxification for the next several days. So if you measure then what's coming out in the urine, you'll see increases in heavy metals. And I believe at this point, they've even done some research on glyphosate and some of the mycotoxins and things like that. I do think that they're quite helpful. I missed the Herxheimer reaction. So there's a couple of things. A Herxheimer reaction really is more of a die-off reaction. So when we're talking about step 9 and we're using antimicrobials and we're getting worse because we're filling our bucket and it's now overflowing, there can also be a detox reaction, which can look and feel similarly in that maybe you're being too aggressive with your detox. You're doing sauna, you're feeling worse, like your body's saying, whoa, what's going on? So some of the rescues in these scenarios with Herxheimer reactions, detox reactions, you have to look at what you're doing, and maybe you're doing too much, so it may not be just adding something else. But Herxheimer reactions, you would think about simple things like lemon water can be very helpful for those types of reactions. Coffee enemas, for me, that would be my go-to. Glutathione in some cases. Alkalinizing the system, whether that's with something like Trisalt or baking soda or one of the easier ones, I think we can still get it, but it's not super easy to find, is Alka-Seltzer Gold, which is then just really shifting the pH of the body and can really help to minimize a lot of those Herxheimer reactions. Walking, rebounding, supporting the lymphatic system, all of those things can help too. But the tools that we would think about in detox and drainage would be tools we would explore to minimize Herxheimer reactions. But if we're also being too aggressive with step 9, with the killing piece, sometimes it's not about adding more step 1, it's about pulling back on step 9.
Okay, great. You ready to move into step 2?
Sure.
Okay, step 2 is improving our external environment. And so tell us why this is important and how we do it, and what things do we need to let go of? And then what about grounding and earthing? And does that come into play here? If not, let me know where that might be a fit to discuss, because I am all about frequency.
Me too, actually. I have my gadget running here and I got other tools that I love. So the external environment, I think it's so critical. Our internal environment, as I mentioned, is only ever going to be as good or as healthy as our external environment. And I think that is why so many of us are sick today. Our external environment is toxic, thus we're toxic. We can take supplements all day long, but if our home, our school, our workplace, our car even, if those are our kryptonite, then we will never again regain our superhero status. It is so critical. So we talk about mold, but the reality is it's really probably not the right term, because when we're talking about biotoxin illness or SIRS, chronic inflammatory response syndrome, there's a lot more than mold. There's mycotoxins, there's bacteria like actinomycetes, mycoplasma, chlamydia, there's endotoxins. And so a lot of this, my understanding, is really expanding rapidly right now in the actinos and endotoxin realm. If people go back and listen to episode 193, I believe, relatively new with Dr. Eric Dorninger, we really dive into that. So when we say mold, people should just keep in mind we're talking about the soup of all the things in our interior building environment, that those are really critical to explore. I would say most people with chronic Lyme have some significant mold exposure in their history or presently if you really look for it. Again, testing is gray. There's no black and white, but I would say using the ERMI, the Environmental Relative Moldiness Index test from Envirobiomics or Mycometrics or Liz Biotech, that can be very helpful. Gravity plate testing from Immunolytics can be a nice adjunct. I don't think it's a replacement for an ERMI. Self-testing has limitations. If someone's super sick and they have endless financial resources, the best thing to do is to find the most experienced indoor environmental professional or IEP and have them come spend a day doing extensive testing. That can be a tremendous way to do it, but that's not going to be the first step for most of us. I am a fan of looking at real-time labs for what is the potential mycotoxin burden in the body itself, what's coming out in the urine. It is debated. Some people say, well, if you're exposed, you could be healthy and you'd want mycotoxins coming out in your urine. That is true. But at the same time, with any lab test, you have to correlate it to the person and to their symptoms, right? Chances are, if they're healthy and feeling well, they're probably not running these tests. And if they do have significant mycotoxins, then my rationale would be, where are they coming from? Why are they there? What are we missing? You can also do that type of testing with Vibrant or with Mosaic Diagnostics. They also do work in that urine mycotoxin realm. And then once we identify the exposure, we either remediate it professionally. That means removing the source of the mold growth or whatever the contaminant is. It does not mean coming in and spraying some fogging solution and checking the box and saying we're done. That is not going to be the solution for those of us with chronic illness in most cases. The other option, if we're not going to remediate, would be to move to a new environment. Unfortunately, a lot of people move from one bad environment to another. So unless it's a significant problem, sometimes remediation is a reasonable path forward. And I would just reiterate, if someone has a chronic condition like Lyme and they haven't explored the impact of mold, I think they are doing themselves a great disservice. It took me a few years. I figured out the Lyme piece 2005. That was the same year Richie Shoemaker's book, Mold Warriors, came out. Took me a couple years to integrate that, start testing, going, oh my gosh, you're living in a moldy apartment. I knew there was mold, but no one told me that was bad for me, right? Mm-hmm. Air filtration devices can be helpful, but they are not the solution. So if you have a mold issue or you haven't really looked into it, just putting an air filter in place is not going to be the solution to the problem. I tend to think of this a lot like cancer, that you need to remove the tumor before you start the chemotherapy. We need to eliminate the exposure. We need to incorporate binders. There are some maybe that are a little more specific for this conversation, the mold conversation, like the Cellcore biotoxin binder, for example, or the Beyond Balance Toxis bind and Pro Myco, the Takasumi Supreme can be great. The pharmaceutical options like cholestyramine and Welchol, they certainly play a role for many people, particularly if they still have an ongoing exposure. Those can be quite helpful. They can also be helpful in the endotoxin conversation, which again is still forming in my mind based on some other brilliant people. When we think about the microbial piece, some people may also need to consider that if you had long-term exposure to a building with all kinds of molds and fungal other organisms, maybe those are now colonized in our sinuses. Maybe they've made their way to the gut. Maybe we have to then do something to that internal mycotoxin production factory. And that's when we get into step 9. But if you were in a sick environment, you can now be in a completely clean external environment, but maybe now the problem has migrated from the external environment to the internal environment. So I think once we either rule out or fix our external environment, probably the most significant roadblock to our recovery has been removed. And it's definitely something we don't want to miss. I probably could have saved myself a handful of years at least if I understood the mold piece a little bit earlier. Then the next piece of this conversation is the electromagnetic field piece. This is a bigger and bigger issue in our world. We are all exposed to cell towers, cell phones, radar, sources of EMFs in our homes, our dishwashers and refrigerators that need to connect to the internet. This is an important area to get a meter and measure, or get a building biologist that's really a professional to come out with their 4 or 5 meters and measure the dirty electricity that's coming from the wiring in our walls. EMF exposure not only may be connected, according to Dr. Klinghardt, to mold in our environment, it may aggravate and make the microbes within us more aggressive as well. EMF exposure is also one of the key drivers of insomnia. That's part of why step 3, optimizing sleep, is step 3 and not step 2, because we really want to make sure that we've implemented proper EMF hygiene in order to optimize our sleep, which is then so critical. There can be some people that have genetic predispositions to electromagnetic hypersensitivity syndrome. I'm not generally a big believer that the genes are the full story. I think we want to work on all these things that are happening in our world that are epigenetically influencing our gene expression, but there are going to be people who are a little more predisposed. Interestingly, one of the things that can be very helpful here as well, still want to minimize the source of the exposure, still want to do as much as we can to not have them in our environment, but limbic system retraining can also help people with electromagnetic hypersensitivity syndrome as well.
And the galvanic reactions in the metal community are a big thing. If you have dissimilar metals, they can create an electrical current, which can make you more sensitive to EMF. So the more metal you get out of the body, the less sensitive you are.
I do think grounding to the earth, walking outside barefoot, hugging a tree, sitting in the park, those kinds of things, going to the beach, I think those are significantly beneficial. And so those would be things I would urge people to do. I think grounding in nature, great, go for a hike, avoid the ticks, but go for a hike, do all of those things. But I have mixed feelings about artificial ways of trying to recreate nature inside of our homes. We need to get out and resonate with the Schumann frequency that the earth provides us.
So let's talk about step 3, which is optimizing sleep. And then why does that come after the external environment?
It's coming after the external environment because of the EMFs. We want to minimize that first, get that out of the way. I think Dr. Klinghardt would generally say the key driver of insomnia is all of the man-made frequencies that we have in our world today. It's just crazy how exponentially these things have increased over the past many years. I think that everyone is going to really be different here in terms of what things may be helpful. The more we sleep, the better everything else we do will work. So this is really a way to catalyze a lot of the other things that we're doing. I always slept really well. And when I was at my worst, I slept really well. And it really was, at that time, the only way to escape the hell of what my life had become. So I was so happy that I did sleep well. A few years ago, my sleep wasn't as good as it should have been. And so step 3, I've had some personal experience with now, but the supplemental things that we think about would be things like GABA or 5-HTP. My drug of choice is melatonin. I love melatonin, magnolia, passion flower, chamomile, valerian. There's a lot of different formulas out there. Sometimes the things that we're maybe missing are, what's your blood sugar while you're sleeping? If you were to wear a continuous glucose monitor, maybe you're having a dip in your blood sugar in the middle of the night. Your body then's creating more cortisol to get your blood sugar back up. And by the time you're loaded with cortisol and you wake up in the middle of the night, you're not going back to sleep. So looking at your blood sugar, measuring your oxygen saturation. Could you have even minor sleep apnea that's really keeping the body in kind of a sympathetic dominance because we feel like, oh my gosh, we're not going to be able to breathe. And so that can trigger the nervous system as well. Weighted blankets can help some people. Inclined bed therapy can help some people. That's actually a really nice tool for also supporting drainage of the glymphatic system, improving sleep. There are devices that can help in this realm too. I would say Apollo Neuro is one that's become well known. The Nikki, Nikki, is another. Brain Tap from Dr. Patrick Porter is another one that I really like. And Dr. Nathan uses that a lot in his practice as well. I think having a tool like an Oura Ring that you can measure your sleep with and watch the patterns of different supplements, different things you're doing. Avoid blue light, avoid your devices at night, see how that shifts your sleep. Don't do things that are too activating to your system right before going to sleep. And so I love that we have tools now where we can go, oh my gosh, look, I started that new supplement. And now for the last week, my sleep has just been amazing. Another thing that we're going to...
the blue light thing. I fail that.
Yeah.
At night.
I
fail it completely.
I'm not great with it, but at the same time, there are on most devices now, like iPhones and whatnot, you can actually set it up so that the device itself minimizes the blue light at certain times of day. And so I do that. Another piece that we'll talk about in step 6, but is worth a mention here, is histamine can really dysregulate your sleep. So if mast cell and histamine is a part of your situation, then that could be a contributor to your sleep problems as well. There are some peptides that people are finding helpful in the sleep arena, but every bit of improvement we can get in step 3 is just going to really exponentially increase the benefits we're getting from all of the other steps.
Let's move on to step 4, which is mental and emotional health. Does that imply, as many of us have been told, that the problem's in our heads, and how does that all interplay here?
I think many of us have had emotional traumas and conflicts that set the stage for our illness. I know I certainly did. I think, on the other hand, being invalidated or gaslit by the medical community, that in and of itself could be our trauma. Either way, whether the trauma came before or after the illness, we still probably need to address that to fully optimize our healing. We all have emotions to work through. And I think accepting that reality doesn't mean that the illness is all in our head, but it is a recognition that mental and emotional health do play a role in the development of these conditions. I'm not embarrassed to say that with the pandemic, I had 10 water intrusions in my brand new home in 2023, lots of triggers. And so I'm now working with someone doing EMDR. It's just like brushing and flossing your teeth. If you have stressful times in your life, well, then you do some self-care. That's an area that I'm exploring again. It's certainly one that I've explored many times over my lifetime. But in the Lyme community, and I think many of these chronic illness communities, I'm going to guess that this maybe fits you too, but I'm going to say that a common pattern is type A overachiever perfectionists that need to prove their worth and value to the world by doing, and in some cases also maybe don't feel deeply deserving of wellness. And so getting these tapes, these messages, these things that we're saying to ourselves, shifting these is so critical. Cultivating healthy relationships, critical. Maybe even more critical, getting rid of the toxic people. Sometimes it's not about adding something, it's about removing something. Experiencing joy, so critical. Not identifying with the illness. I never took on the term limey. The illness was part of me, but it's not who I am. And so I think it's important not to take it on as your identity. And then in the Dr. Klinghardt model, he has what he calls the 5 levels of healing. This is 3rd level work. So think of a pyramid. The bottom level is physical. The 2nd level is energetic. The 3rd is mental, emotional. The 4th is intuitive. And the 5th is the spirit body. And anything that we do on the higher levels have a downward effect on lower levels, meaning I can take lots of supplements. I can do nothing but work on the physical level, level 1. But I'm going to get much more bang for my buck by working on level 2, 3, 4, and 5, even in terms of what happens on level 1. So tools in this realm that I think can be really helpful are EMDR. That's the eye movement desensitization and reprocessing. If people are watching, I was showing the eye movements a little bit. Applied psychoneurobiology, psychokinesiology, tapping tools like EFT, emotional freedom technique, NET is another system, emotion code, Bradley Nelson's work, also very, very helpful. There's emerging tools in this realm that I don't have a lot of experience with, but I'm learning about. And those would be more psychedelic interventions like ketamine, psilocybin, things of that nature. I think we're beginning to have more recognition around the fact that those can be really helpful. I didn't know until fairly recently that ketamine is a phenomenal tool for neuroplasticity. I was like, wow, that's amazing. I just recently had a psychiatrist on the podcast. And so I have a different perspective. And then I would say people getting into this realm, if they really are ready to work in this realm, I'd say a lot of people are resistant to the mental emotional work. I used to think that Killing the bugs was number one, detoxing number two, mental emotional work. These are part of the Klinghardt axiom, these three pieces. I now think the mental emotional piece is number one, the detoxification number two, and the bugs, the lower part of the priority. But if people are ready to do this work, Amy Scher, she has a fantastic book called How to Heal Yourself When No One Else Can that really goes into how to help remove the cellular imprint, the cellular memory of traumas, conflicts, emotions with very practical things that you can do, like tapping and certain scripts and things you say. She's just absolutely amazing. So I would encourage people to look her up.
Awesome. We will do that.
And now, a word from our sponsor. Attention metalheads. Are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with MelySA testing. MelySA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit MelySA.org to learn more and schedule your test. Trust us, you'll be glad you did. MelySA, a valuable diagnostic tool in medicine.
What is the role of step 5, which is retraining the limbic system? I'm excited to talk about this. And then we tonify the vagus nerve and parasympathetic nervous system. How can not doing this as a key component of regaining our health keep us sick and perpetuate symptoms? And this may be a brand new concept for my listeners.
Yeah.
So please explain the basics.
I think this is a step that could make sense in some cases earlier, in some cases later. It really depends on what each person is dealing with. I think there are going to be some people that maybe can't tolerate any supplements at all. They're super sensitive, and then doing some limbic system retraining can open the toolbox of what their body can tolerate. But for the most part, I think the limbic system work comes after you've addressed your tiger, so to speak. If I was living in a moldy house and that was the thing that was threatening my system, moving me into a cell danger response, hypometabolic state, shutting things down, the hurricane shutters have come down, we really probably want to address those things. And then I think of limbic system work as more of a recalibration of perceived threat and actual threat. So if the tiger, your house that was full of mold, is now the cute kitten walking outside the street because you had it remediated and everything looks good, but your limbic system now sees the kitten and reacts as though there's still a tiger, that's where you want to reboot and recalibrate things. So the limbic system is the part of the brain that includes the hypothalamus, the hippocampus, the amygdala, the cingulate cortex. It's what some call the feeling and reacting brain. It's what we use to determine our level of safety. It's our alarm center or safety switch or surveillance operation. What's happening around me? Is it safe for me to be here? And the limbic system impacts the immune system. It impacts our hormones. It impacts the autonomic nervous system, which then affects blood pressure, heart rate, breathing, digestion. So you can't tell me that the limbic system is not critical, right? And I know you're a huge fan of this work, and it was critical in your own recovery. Many different things can trigger limbic system impairment. This could be mold exposure. This could be Lyme co-infections, a significant chemical or pesticide exposure, any pathogen, physical, mental, emotional trauma. But again, I separate it from mental emotional because I feel the resistance people have when you start talking about things that are in the head. The last one was the mental emotional step. This is the brain, not the mind, but the brain. So if we think about these threats again, like Lyme disease, and we've now treated it, you want then to use these type of tools to really drive that recalibration, because an inappropriate response of the limbic system can continue to negatively impact our immune system and our endocrine system and our nervous system. I personally would not do DNRS if someone was still living in a moldy house, for example. There are going to be cases maybe where somebody does benefit because they couldn't tolerate one capsule of charcoal and they do some DNRS and now they can take charcoal and thus they can move forward. At the end of the day, though, I think that's a slightly different reason than why we're normally doing limbic system retraining work. I think it is, again, important to separate this from the mental emotional work because it's so powerful and I see so much resistance to it. I see misperceptions that people have that maybe their belief is that the teachers of these systems are saying, well, if you just do my system, you're totally fine to live in your moldy house and you'll be healthy again. That's not what they're saying. These are still built on a platform of environmental awareness. So we want to make sure that we are still working with our environment, remembering that these are really physical biochemical responses that we're having in the amygdala, in other parts of the limbic system. And I would say of all the tools that I have seen where one thing really shifted things for people, limbic system retraining has been that tool. DNRS, Gupta, Primal Trust, amazing for many people. I think of these as what you call driver's seat limbic system tools, meaning you have to participate, you have to do something. It takes time every day to implement these practices. I really urge people to do it. But if they're not willing to or able to do it, then as one of my colleagues calls it, you could then look towards passenger seat limbic system tools. And that's going to be things like brain tap and frequency specific microcurrent. That's going to be tools that are overlapping into the vagus nerve and the nervous system, maybe tools like heart math. There's a lot out there now where we can really start working with the autonomic nervous system as well. But I think the key here is calming the limbic system, recalibrating our perception of the threat to the actual threat. We don't want to perceive it bigger than it actually is. And then working just to really calm down that autonomic nervous system. We cannot heal in a fight, flight, or freeze state. We have to calm the system to heal and to rest, digest, detoxify, and heal.
So true. Okay, so step 6 is stabilizing mast cells, reducing inflammation, and modulating the immune response.
I feel that this step is probably more important than step 9, which is the bug piece. I don't think that getting healthy is about killing bugs. The bug is not what makes the disease. The host response to the bug makes the disease. And in your realm, the host response to the metal makes the disease worse, right? So if your immune system is hyperactive, overactive, responding in an autoimmune fashion, that's likely creating a lot of the symptoms that we perceive as our illness. And a lot of the inflammation that we experience is driven by mast cells, by histamine. A primary trigger of mast cell activation is mold, but there's others that are important too. Parasites, Lyme disease, all of the environmental toxins, some medications, supplements. We know many people, their trigger is actually high histamine foods. Some supplements can be triggers for people. Even changes in temperature can actually trigger mast cells. And then any physical, mental, emotional stress as well. I mentioned environmental toxicants, and I should clarify that that includes metals, chemicals, pesticides, all of these things. 100% agree with you. Dr. Theo Theoharidis, who's probably one of the best known mast cell researchers, many years ago at a conference, even having a reasonable understanding of this at that time, he commented that mast cells are 10 times more active in the presence of a cell phone. So if just being around your cell phone is activating your mast cells by 10 times, wow. Like, to me, that's like a shocking, that's like
I'm screwed. I'm literally screwed.
Ideally, in this particular scenario, we would consider a trial of a low histamine diet. I think it is very helpful for many people, either their symptoms reduce or the severity of their symptoms reduce. I think it's important to think about what are some of the things we do that we think are healthy that maybe aren't. Kombucha, avocados, bone broth, fermented foods. Wait a minute. What? You're telling me these things are bad for me? Well, if you have mast cell activation and histamine issues and lots of inflammation, yes, it may be the wrong thing at this time, might be the perfect thing in the future. Once we've worked on the dietary piece, the low histamine diet, then bringing in some mast cell stabilizers and histamine reducers, whether it's quercetin or luteolin or holy basil. Dr. Theo has a product called Neuroprotect that I love. Ben Lynch has created a product called Probiota Histamine X from Seeking Health that I love. Quicksilver has HistaAid. Research Nutritionals has HistaQuell. There's so many things. Ketotifen, Chromalin, DAO, lots of tools we can use here.
Better than over-the-counter histamine medications?
Good question. No, so there is a place for H1 and H2 blockers, which could include the Claritins and the Allegras and the Zyrtex and so on. And then famotidine or Pepcid has a place for some people as well. So yeah, absolutely, you can benefit from some of those also. And I think once we've worked on reducing the dietary exposures, worked on some of these stabilizing antihistamine type things, a lot of times people feel much better. And then just in terms of modulation of the inflammatory response in general, pro-resolving mediators or SPMs, those can be very, very helpful. So the last part here of step 6 that I think is really important is just immune modulation in general. So how do we calm the immune system, create tolerance, create integration? That's going to be tools like low-dose allergen therapy, which is also known as LDA. You can do that for lots of environmental things. You can do it for foods. There's also LDI, which is low-dose immunotherapy. That's an extension of LDA that was created by Dr. Ty Vincent, where we also are modulating the immune response to infections. Low-dose naltrexone can also be very, very helpful in talking about immune modulation. There are other systems of energetic desensitization that can be helpful in dealing with sensitivities and things of that nature. So NAET or Nemburopod's allergy elimination technique. There's Bioset. There's one called Ellen Cutler method. I did an interview with Dr. Ellen Cutler. She's amazing. Those could be helpful tools in dealing with metal hypersensitivity as well. And then I know you have talked about your experience doing Lyme Stop with Dr. Tony Smith. He also has a tool called Craniobiotic Technique or CBT. I've not talked to him about its potential application in metal hypersensitivity or metal allergy, but you should, because
I'm going to Coeur d'Alene in a few months, so I will put that on my radar.
I think it has a role. We hear a lot about peptides these days. I think this is the step where peptides really shine. Thymosin beta 4 or KPV, or I think it's difficult to get now, but we used to have thymosin alpha 1, things in that realm where we can use these peptides to really modulate the immune response, to work on Th1, Th2, Th17, all of that. We have so many tools in this modulation realm, and I think that it is really critical to figure out how is the host responding to these toxicants, to these infections. And if we can adjust the response, we can actually significantly improve the condition.
So interesting. So much there. Let's talk about step 7, which is optimizing hydration, nutrition, microbiome, and gut health. And what tools do you find helpful here? What might need to be modified for those with metal hypersensitivity? And then how can we go low and slow, and what can be done instead if it's going to affect us, maybe homeopathic remedies? I know as we implement nickel detox steps early on, we can tolerate more over time. So there's that.
I think hydration is so key. Many people in this realm with biotoxin illnesses, they can drink all day, drink gallons of water, pee it all out because of low antidiuretic hormone, and still be dehydrated, even with all that we're drinking. Structuring water can help make it more cellularly hydrating, adding some electrolytes, trace minerals, a pinch of sea salt. Those can all be helpful. There's lots of tools we can use to structure water. There's the Natural Action Water System is one that I used a long time ago. The one that I use now is called the Analemma Wand. There are some homeopathics that can help with hydration as well. There's one from Energetics called Rehydration that can really help us to get the most hydration from the liquids that we are consuming. And The next piece would be looking at the fact that the immune system largely comes from the gut. So if we're dealing with nutrition and we have leaky gut, for example, and we're triggering more immune dysregulation and more mast cell activation, we need to first remove the triggering foods. So I would say in your community, it's going to be probably a lot of the high nickel foods. In general, Lyme, mold, those types of things. Gluten, probably not good for anybody. So I think gluten needs to be removed. I think cow dairy, some people need to remove it. And at a minimum, if you're having cow dairy, have A2 cow dairy, not A1 cow dairy. Sugar is going to be bad for most people. High histamine foods going to be bad for many people. This really has to be highly individualized, but making sure that we're at least removing those things that are stressing us. And then with what we are taking in, we need high nutrient density. For me, every morning, my favorite meal of the day is a liquid power shake that has things like high quality protein, collagen powder. Yes, some people with mast cell and histamine need to be cautious about collagen powder.
And alpha-gal.
And alpha-gal, true.
There are a few of us.
Yeah, I'm not sure. I think with alpha-gal, there are some collagen powders that are derived from
Marine.
eggshell. Yeah,
really?
so there may be some options there. I put fiber in there. I put phospholipids like phosphatidylcholine and all of the other phospholipids. I put some olive oil in there. I put a blend of other healthy fats in there. I may put some seeds in there, organic nut milk. It's like drinking a liquid brownie every day, and yet
sounds like a nickel nightmare.
Which ingredients?
The olive oil's fine. The nut milk would be problematic for many. Fats are fine. Meat is fine. Basically, anything plant-based can be problematic. So like cucumber's fine. Apple's fine, but you get into leafy greens like the kale and the things we know and love.
I mean, I will say the protein powder I use is like a pea derived. It's a professional grade medical food kind of thing. So the company, I'm sure, could tell you whether it's tested for nickel.
If we could find a white rice protein powder that was not contaminated with arsenic, I think that would work. Aside from that, most of the high vegetable stuff, people with systemic metal allergies, even at a cleaner stage like I'm at, can't tolerate, which sucks.
Okay. I don't think there's going to be many ingredients in my shake, actually, where that would be a concern. Moving a little bit from the gut is the microbiome. And so that's actually an area that I'm working on as a focus now. I was on antibiotics for so many years for Lyme disease before we knew all these other herbs and beautiful things existed or were available to us. So the microbiome, I still have some optimization to do there. I really like the Megaspore biotic, the spore-based probiotics. Those can be great. They seem to be well tolerated in people with mast cell issues, with SIBO as well, providing those keystone strains that optimize our microbial diversity. They can help with inflammation. They can help with immune modulation as well. They can help with intestinal hyperpermeability. And so things like Megaspore, BPC 157 as a peptide can also help with leaky gut side of things. Butyrate can be great. This is also the foundational piece. What are we drinking? What are we eating? And how are we supporting our gut health and our microbiome?
Perfect. Supportive interventions are important. We address those in step 8, and that includes interventions such as mitochondrial support, adrenals, KPU, and anticoagulation. I'm excited to learn about this because this is an area where I know painfully little.
One of the areas that I have become more interested in the past few years is the mitochondria. And I think we need cellular energy. We need ATP to do all of the things the body needs to do. It doesn't detoxify. It doesn't function. It doesn't repair at some cost. It needs energy. It needs ATP. And so I like red light therapy in this realm. I think that can be great. There's a lot of supplements, CoQ10 and PQQ. There's lots of different applications of NAD, a lot of the precursors like nicotinamide riboside and NMN and NADH and all of these things that are available. And so I think the mitochondrial piece is important. At the same time, ATP is the danger signal in Dr. Bob Naviau's cell danger response model. So in people that are still facing their tiger and their bodies have pulled down the hurricane shutters and are not putting them back up because it's in kind of this protective hypometabolic threat kind of state, we sometimes need to be a little cautious about being too aggressive with supporting the mitochondria. If the mitochondria are sending out all these danger signals, sometimes trying to amp them up even more might not be the best strategy. So I'd say slow and low. Then the adrenals, people are familiar with that, whether you call it adrenal fatigue or exhaustion, which is probably not the case. It's probably more hypothalamic pituitary adrenal thyroid axis dysfunction, more of the control mechanisms than technically the adrenals being burned out. But providing some adaptogens can be very helpful. Holy basil can be great, and that also helps with the mast cell piece, with the fungal piece. It checks a lot of boxes. Dr. Klinghardt introduced me shortly after I met him in 2006 to the concept of KPU, or cryptopyruria, or hemopyrolactamuria. It goes by KPU or HPU. This essentially is a condition where you pee out your zinc and your B vitamins. So you then don't have a fully competent immune system. He likes to say that your white blood cells are then like an army with no bullets. So sometimes you have to support zinc, B6 or P5P, as well as some other cofactors as well. And sometimes that's just something you need to do long term. It's a relatively easy thing to do. I would suggest that people moving into that realm, also slow and low is better. If you start flooding the body with zinc and the body starts releasing heavy metals, you can really trigger the inflammatory response and feel much worse. So all of this is a marathon, not a sprint. And when we approach healing as a sprint, we probably make the process even longer. The last piece, hypercoagulation, which I've done a podcast with Dr. Ann Corson, who's one of my heroes. We go into great detail there. This has been an issue for me personally in my own Lyme journey that I've had to really stay on top of, which is, well, if heavy metals, if Babesia, if other infections and toxicants are causing a thickening of the blood where the blood is hyperviscous, then nutrient delivery is impaired and waste removal is impaired. The testing is somewhat complex. There's many tests you have to run and look at, and that there aren't very many people that really understand it in depth. But you can do things here like a lot of the enzymes, like nattokinase, like lumbrokinase or Baluch. There are pharmaceuticals as well, heparin, Lovenox, and some other newer ones also. This has become even a bigger issue since the start of the pandemic. So these clots and microclots and all of those things that people are experiencing, I think there's a lot of attention now in this hypercoagulation arena. I still try to do some, not the full panel, the ones that are usually my clues that something is not quite right. I still try to check at least once a year. Just like if somebody's checking their cholesterol or their homocysteine or whatever, I like to make sure that my coagulation markers are on the right path, because if suddenly something's a little off, then you're going, whoa, what's going on? Did I release a bunch of metals? Did I try to do something too aggressive? Is there a microbe? Is there something else going on? So I think hypercoagulation of all of the things that we're talking about is probably the most overlooked critical piece of the puzzle that people should explore with their practitioner. Metals can be big drivers of hypercoagulation.
So interesting. Definitely have to delve more into that. So I appreciate you bringing that to my attention. So step 9, quite popular. How do we support the body with microbial overgrowth?
You and I both know that killing the bugs is not how we restore our health. We talked about the host response as being so critical. So once we start supporting the body, we've gone through these other steps and we want to get then to the pathogen piece. The order can change. I generally like to start with viral and retroviral support. I think in part because the viruses can be such drivers of symptoms, and many times the antiviral interventions, particularly in the natural realm, are pretty well tolerated. People don't have huge negative responses to them.
Can you get rid of BBV?
Can we get rid of it? Probably no. Can we get to a point that our immune system manages it and it's never a problem again? Sure. So then we move from the viral, the retroviral pieces into more gut, parasites, SIBO, those types of things. The gut is really critical. Then I tend to think of more fungus, yeast, and mold. So that could be Candida or Candida, but it could also be maybe some sinus or gut colonization that we had from living in a moldy house for 10 years that we didn't know about. Then I think of moving into Lyme and co-infections, and then maybe to biofilms if someone needs to go there. I don't think everyone does, but some certainly do. So if we look at reactivation of EBV, HHV6, herpes zoster, the idea that we're all born with endogenous retroviruses that EMFs and other factors can make worse or reactivate, then I think we need long-term support here. Some of my favorite tools would be the EN-V product from BioPure, Cystis T from BioPure. There's tools from Beyond Balance, IMNV2 and 3 that I love, but also just things like sulforaphane, which is like essentially broccoli sprouts, or pantothene, or selenium, lysine. There's also homeopathics that we can use in this realm as well. So working on the viruses, then thinking about parasites and SIBO and gut issues. It's funny that some brilliant people still have the idea that if you haven't been out of the US, you can't have a parasite. And that's not been my experience. Testing is poor. So yes, you can do functional lab testing, and there's diagnostics and the GI map and Genova and lots of great labs. But I think this is an area where then also combining it maybe with some energetic testing, like autonomic response testing, like Zyto, like Quest 4, like Simon Yu's acupuncture meridian assessment. All of those can be great. There is a lab with Dr. Rafael D'Angelo in Colorado called Para Wellness Research. I think he does great work looking at stool and urine under the microscope, and it's rare that he doesn't find parasites in people. Parasites can be larger nematodes, helminths, the worms, but it can also be protozoa like Giardia or Cryptosporidium or Toxoplasma. So I usually like a combination of something herbal, like Dr. David Jernigan. He has a Paragen product. Beyond Balance has Paralivier, but then combining them with homeopathy like Unda 39 or Energetics Paracord. In many cases, this is an area where Dr. Klinghardt and Dr. Simon would say pharmaceuticals really do play a role. So if there are pharmaceuticals that I like, it's going to be in the anti-parasitic realm. And then remembering that as
we're killing... can't mention, that one?
That's one of many. I think in this context, we're talking about it and what it was intended for, but there's a lot of them. Alinea, albendazole, pyrantel, the one you're referring to. As we're killing parasites, we also might be releasing more metals into the system, right? So in theory, if somebody's metal hypersensitive and they're on an aggressive parasite protocol, they're releasing metals, they might be triggering more of their metal hypersensitivity. So we want to make sure that we're continuing to detox, that we're keeping that in mind.
Let me interject why that is. Most metalhead people that follow me probably don't know that parasites can hold up to 10 times their weight in metals. So parasites are super high in the metals. Mr. Scott is not wrong here.
And then when we think about SIBO, lots of people have the idea again here, like, oh, if we can just kill the bug, that's small intestinal bacterial overgrowth. There could be SIFO, small intestinal fungal overgrowth. I like to throw out the idea of SIPO, which is small intestinal protozoan overgrowth. I thought that was unique, but then I Googled and someone else had that idea already. So, but I think the overgrowth, whatever it is in the small intestine, is probably the result of other upstream, or what Dr. Corson would call headwaters issues, meaning it's not so much the cause, but the cause maybe is more neurological, the autonomic nervous system, the vagus nerve, the migrating motor complex, bile flow, all of those things. So yes, you might need to do something in step 9 to support addressing your SIBO, but if that's all you're doing, it's going to come back. We then have other GI dysbioses like Clostridia, Klebsiella, H. pylori, all of those, Biocidin, Megaspore Biotic, Beyond Balance, IMNGI, IMNV2, lots that we can use there to balance the biome. And then we have the fungi, which are yeasts and molds. So people will probably know of Candida or Candida, but we can have that colonization, maybe of Aspergillus from our water damaged building. And one of the challenges, again, is when we start killing fungal organisms, we also have the potential to release metals back into the system. So step one stays in place. We need the detox and drainage piece consistently. Lots of good tools that we can think about in the antifungal or fungal support realm: Byron White, A-Fung, Beyond Balance, Mycoregen, Candibactin. The list, we really have so many great options in the natural realm now. This is an area where some people, particularly for the colonization from maybe water damaged buildings, some people may use tools like itraconazole, which is a pharmaceutical, to address that fungal colonization piece as well. And then finally, in step 9, we start thinking about, well, what about Lyme or Borrelia and Bartonella and Babesia and opportunistic infections like Mycoplasma and chlamydia and all of these things? I tend to like tools that are more targeted, where you can layer things in. So if we brought in something that was going to work on all of those early on, that might just be too much for people, might overflow their bucket. They may not be able to tolerate it. This is where I like some of the tools from Beyond Balance, Byron White, Nutrimetics, where we can be a little more specific. Okay, let's start with Bartonella. Let's do that for a while. Then layer something in for Babesia. Then layer something in for Borrelia. Later, you may be fine tolerating something really broad spectrum that's a strong intervention. I think it's also helpful because if we're working more specifically with tools that are supporting Bartonella or Babesia or Borrelia, and you can see then, to your earlier point about the provocation, if you can see, oh my gosh, look, when I added this, they got better or they got worse, that's really good information for the practitioner to say, wow, we brought in 1 drop of something for Bartonella and the OCD and anxiety and rage went off the charts. That's probably the area that I need to focus on. So once we have this kind of layered approach that's been implemented, then we can later do broader tools. We can think about biofilms. I don't know that everyone needs to work with biofilms. There's healthy biofilms in the body too. We don't want to go just getting rid of all the biofilms in our system. They do serve a purpose. So maybe one of the selective, according to Dr. Klinghart's biofilm tools, would be the Cystis T, where you're not going to completely destroy all of the biofilms in your system. And drinking a cup of tea, though, to your audience, I think there are some teas that are higher in metals that we have to be cautious about. That's one option in the biofilm realm. There's also lots of products that are enzyme-based products, the Interface Pluses, the MCBFM products like Beyond Balance. I think people can really do themselves a disservice if we start doing that early in a protocol. If you start opening Pandora's box when you are not pretty far down the path, you're going to trigger a lot of these things. You don't want to release a lot of metals and infections and things that are stored in biofilms, because then the immune system is going to respond to those. So biofilms, I feel like we have to be a little bit cautious. There are obviously pharmaceuticals in the Lyme and co-infection realm. I benefited from them some. I wouldn't do the same thing again today. That's been many years ago. We have a lot of other tools now, but there are protocols emerging with disulfiram and dapsone and some newer tools that are being explored. They're good to have in the toolbox. I know some people that have tried every natural thing possible, and they really got better when they did pharmaceuticals. I'm not against them, but I think we have to think about they might have a negative effect on our mitochondria. Some of the tools that I like in this realm are going to be from companies like BioPure, Vital Plan with Dr. Bill Rawls, Supreme Nutrition that we talked about earlier with the Takasumi Supreme. That's Dr. Michael and Noah Leibowitz. They have some very clean, fantastic products. Beyond Balance, Des Bio, Research Nutritionals, Nutrimetics. And for people that maybe think that herbs are not strong enough and they have to have pharmaceuticals, if you can take many of these herbal products and have someone herxing from 1 drop of something, it's not a lacking of power, right? I think it's just a perception. I actually think nature is far more intelligent and complex than we will ever be able to synthesize a medication around. The other things we can think about, ozone can be very helpful for some people. There are some antimicrobial peptides like LL37, for example. There is, unfortunately, not yet available outside of Dr. David Jernigan's office, but hoping to be. There's a newer technology called INPT, or induced native phage therapy, which is a way to get the body to deal with a lot of these microbes. There is Lyme Stop in Coeur d'Alene, Idaho, with Dr. Tony Smith, which I've done and have done a podcast on that for people interested. That's another great tool. And then there's a lot of frequency devices. I have had experience with Rife. In fact, I also own a GB4000, which is the one that you worked with. They never came to the top of my list because I felt like it was always a little bit like going to Las Vegas, putting your money in the slot machine. And if the next day you couldn't get up and walk, then you hit the jackpot. But it was a little too hard to know which frequencies actually were going to be the thing that moved things forward.
The sad thing about that is there was a group online that was called Rifing Lyme, and the admin finally shut it down. There were thousands of people in there, and they had come up with some frequencies that literally were just bullseyes for almost everybody.
Yeah, the concept is great. I like frequency. For many years, I used a device that unfortunately is not available anymore. It was called the Wave 1 from a company up in Canada. The good news is the same frequency set they now actually offer on this other device called the Nikki, which is just more like a watch that you wear. It's a tool that I still use every day. I don't focus a lot on microbes, but at the same time, I think we know these things are not fully eradicated. So just to provide some ongoing support, there's other ones. I just recently learned about another one called the Wave Watch, WAV Watch, that I'm interested in as well. So lots of things that we can do here in addressing some of these microbes.
Okay, step 10, you talk about exploring dental contributors. Many of my followers might be doing this early on, but why does this come so late in your process? And would this maybe need to be moved up the chain for those that are metal allergic?
Yeah, I think certainly for people with metal hypersensitivity, these type 4 reactions that you have talked about in our wonderful conversation recently, I think it may make sense to move these things up earlier, because in that case, if the trigger again is within you, it's the metal, the implants, the dental metals, and so on, then absolutely it could need to come much earlier. Part of the reason I put this later is because I think people respond better. Some of this includes surgical interventions as well, beyond just removing, let's say, an amalgam. It might be a cavitation surgery. It might be something like that you need to address. I think we want to have the body as supported as possible so that we respond better to any significant interventions, that we heal better, that we don't have a lot of side effects. Dr. Klinghardt would say that a lot of the dental issues we have, particularly around cavitations, which are infections in the jawbone, generally speaking, in areas where a tooth was previously extracted, that the retroviral piece plays a role there. So we want to do something ideally to have supported that retroviral activation so that we're setting the stage for optimal outcomes. Dr. Simon Yu, who's been another one of my mentors in St. Louis, he oftentimes would like to address the parasite piece before putting people into some of these dental interventions. But essentially, amalgams, metal, root canals, those types of things in many cases are going to need to be addressed. Cavitations play a significant role as well. If we have these jawbone infections, and we can have Lyme and co-infections and retroviruses and all these things. So sometimes those need to be addressed, and that usually is a surgical procedure.
I just did a great episode 22, Living Well with Dr. Michelle. She's an amazing one to follow. Dentist out of Utah who really specializes in cavitation and jaw surgery. And she was poisoned herself by mercury, and she is amazing. We just did an episode with her, so this will tie back perfectly to everything you're talking about.
I'm going to listen to it. The other piece here that kind of dental, kind of not, but I put it in here as thinking about the tonsils. Sometimes the tonsils can be a reservoir for a lot of these infections. I personally, in my own journey working with Dr. Klinghardt, I was his patient from 2006 to 2012, went to Germany twice and did regenerative cryotherapy where they actually freeze the tonsils and then they regenerate. But in some cases, people may need to get their tonsils removed. That's probably not going to be most adults, but it is worth a mention
had
here.
strep like for the first time in 10 years, and I do have my tonsils, but I didn't know infections could harbor there. So now you give me another thing to look at. Thank you.
Actually, another area that I'm exploring, I've never mentioned it anywhere yet, but kind of in this dental realm is the idea of tongue tie, where some people have to go in and have a frenuloplasty or frenectomy. I'm in the decision-making process now, kind of sitting with it, feeling like, do I resonate with it or not?
Very common with EDS and people with metal hypersensitivity because they're predisposed to EDS. And it is a big thing with people with hypermobility.
So there can be significant interventions here. The other piece, though, is also just maybe we don't need to do something significant, but what are we doing every day to minimize the microbes in our mouth? That could be an essential oil blend like Oral Defense from Supreme Nutrition. It could be the dental Sidon product from Biobotanical Research. It could be probiotic lozenges like Oramax from Research Nutritionals. It's interesting and a little frightening that if we look at the brains of people with Alzheimer's, we find a lot of these oral pathogens, the Treponema denticola, the P. gingivalis, those kinds of things. So if we're focused on our systemic health, you can't focus on the systemic health without focusing on the oral health. Again, my thought in putting this at the end is it shouldn't be taken lightly. When people are doing this work, I also urge them to bring their team to the table. The dentist or surgeon should be talking to the primary doctor or what I call the captain of the ship. Want to make sure it's the right time. A lot of times when we're doing these things, we need more microbial support because these can stress the system and the microbes can become more activated. I think in your population, there are going to be people where this absolutely comes earlier, but I think we still want to give consideration to making sure that the body really is supported before we do something that might be stressful.
Okay, perfect. So step 11, which is the final step, you mentioned regeneration and restoration. Tell us more about that.
I love the analogy that David Jernigan shared with me, which is that we can get rid of all of the termites, the bugs, the toxins, the metals, all of these things, but we may still have some structural damage. We may still have some wood rot. We need to repair and restore and regenerate the body. Maybe we've addressed all the termites, but now what are we going to do to support the body? There's so many things in this realm that I think can be just fantastic. Some of these could come earlier as well. Hormone replacement therapy, for example. Sometimes if you do this too early, same conversation around the cell danger response, the body may be intelligently reducing testosterone, reducing thyroid, all those things to protect you, to put the brakes on. And then you kind of come along and you're pouring gas on the fire, so to speak. But at a certain time, even progesterone for sleep can be magical for people. So maybe progesterone comes in earlier. I do think there's a place for some hormone optimization. Phospholipids that we talked about in context of the Power Shake. You can do a lot for cell membrane health. We are only as healthy as the health of our cell membrane. So what can we do? Bringing in lipid replacement therapies. We can do some of this orally. There's also IV interventions along the lines of what many refer to as the Patricia Kane protocol. So making sure that we're really supporting our cells. Peptides, again here, beautiful. BPC 157 can be so restorative, regenerative in this kind of regeneration phase. They are, in some cases, becoming a little harder to find and access. Unfortunately, some of these now are gaining so much interest that they are becoming pharmaceutical medications, like some of the Ozempic and some of these kinds of tools that maybe have been around for a while, but now they're making them drugs. And so they're a little harder to get in some cases. Photobiomodulation can be great. Red light therapy can support the mitochondria. Many people with Borrelia, with Bartonella, with Ehlers-Danlos have collagen issues. And so red light can be great for kind of supporting collagen, supporting our structural integrity, giving us more vital force. I use red light therapy almost every day. Another tool in this realm that I'm quite honestly less excited about, but I'm hopeful that it will become more exciting over time. Stem cells and exosomes and things like that. I did stem cells many years ago before I really understood this, and I don't think it was significantly helpful. I think they can be helpful if you have a bad knee or a bad joint, something like that. But in terms of like systemic health, I don't think there's a get out of jail free card. I think we got to go through all of these steps and address everything and not just jump to some of these tools that we think are going to solve everything. The other one I really like and use, and right now this time of year when it's minus 10 degrees outside and I can't do my 4-mile walks every day, is exercise with oxygen therapy. So there's a system called Live O2 or Live O2 where you exercise while you're wearing a mask. They call it adaptive contrast, and you're moving from 90+% oxygen to 14% oxygen, depriving yourself of oxygen and then flooding your body with oxygen. And I love EWAT. So that's another tool. I think we're going to find more and more tools in this realm, but making sure that once we address the termites, that we figure out what we need to do to repair, restore, and regenerate.
Okay, perfect. So what support groups and websites and platforms have you found the most helpful? And then to tag onto that, what are the keys to finding a supportive medical practitioner who believes these concepts? Key traits to look for, and a really important one is, when do you move on? And is that part of limbic system retraining and getting rid of the toxic people?
That's a good question. The challenge, I think, with online support groups, while I think there are some that may be helpful, sometimes you get a little bit of a biased impression because usually the people that healed aren't there. They moved on with their life and they're back to doing whatever they're doing. And so you get a little bit of a warped sense of reality that everyone's still sick. And that's not necessarily the case. And I think sometimes they can trend a little negative, understandably. It's not a criticism, but people are struggling. Finding a local support group, some of them are still in person, some of them have shifted to virtual, can be helpful where you're having more live interaction rather than just someone sitting behind a computer and typing whatever they type. LymeDisease.org is one site where they have references. Actually, Dr. Bill Rawls on his site too has a support group directory where I think people can access more real-time kinds of support groups. Again, a lot of those now, because of the pandemic, are available virtually, but I would say that's a good option. My website and podcast are an option. If people are dealing with Lyme disease, the International Lyme and Associated Diseases Society, ilads.org. The International Society for Environmentally Acquired Illness is ISEAI.org. That's a great place to find practitioners as well. In terms of things to look for in a provider, while this is not universal, I would say some of the best providers that I have found are those people that themselves have experienced Lyme disease, mold illness, whatever the conditions are that you're dealing with. It's amazing how passionate people can get when they or someone in their own family are experiencing these conditions. A lot of times that helps. They're obviously much more likely to believe you. And again, I think getting to resources that you know ahead of time are already focused on Lyme or mold or metal hypersensitivity, and people that you vetted within the community. Talk with people in these support groups and make sure that the people that you're going to are going to be open and supportive and have a history, a good track record of supporting people with similar types of conditions.
Tell us a little more about your personal coaching program, and could it be designed or tailored to fit people with metal hypersensitivity?
It's a good question. I honestly don't do a lot of one-on-one coaching just because my time doesn't always allow me to do that. I will as my schedule allows. And a lot of times that's just kind of reviewing where people are, trying to help connect them to resources and practitioners that might be able to support them, maybe bringing some new insights from my 25 plus years in this realm. It's a little more my focus, trying to more broadly share knowledge through the podcast, through the blog posts, those kinds of things. But if people are interested in talking about coaching, they can certainly reach out. It's not something that I dedicate a lot of time to, unfortunately. I wish I had more time. I know you wish you had more time.
Understand. Well, you've given us so many amazing things to think about, and I really am grateful for that. Is there anything that you wanted to cover that we have not already covered?
I guess I would just say I'm super grateful. I'm grateful not only for you having me on your show, but for you having been on my show and for you reaching out to me several months ago and really highlighting how important the metal allergy, metal hypersensitivity type 4 reactions are. It's certainly another piece to the puzzle that I'm grateful that you, even though Dr. Klinghardt brought it to my attention many years ago, you very much brought it to my attention again. So thank you for that. And then I would just say that for people listening that are dealing with chronic Lyme particularly, I'm also on the board of the Limelight Foundation, which is an organization that provides treatment grants to children and young adults that are not able otherwise to access medical care. So if someone's listening and interested in supporting the organization or potentially could benefit from a grant, please feel free to check out that information at limelightfoundation.org. And then lastly, so important not to lose hope, not to give up. So much has changed. There's so much happening in this realm. It's almost hard to keep up with all the new cool things that we want to go try this and try that. Right. And unfortunately, then I try 2 or 3 things and you go, oh my gosh, that was a little too much. But I think that it's important to know that we have more hope now than ever. New tools, new solutions are emerging, and people are getting better.
It's not a life sentence anymore, for sure. Okay,
Agreed.
Scott, you know I have to go here. I know that Scott is not traditionally a fan of heavy metal music, but I have to ask you if you have a favorite heavy metal band or favorite heavy metal song, even if it's just a distant memory from your reckless youth or not reckless youth, because you were probably a perfect kid.
It's funny that you asked me that, because my original response when Sherry sent me this question ahead of time was to say that I've detoxified all heavy metal from my life and that I don't listen to heavy metal. But then she said, no, you have to have one. So I basically said that even though I don't know much about heavy metal music, it's just not something I have listened much to. I did look up a list of the top 100, and the one that resonated because of a lot of what we talked about is We're Not Gonna Take It by Twisted Sister. So
of course. Well, that's how I close my podcast if you know anything about me. In the meantime, tell us where people can find you.
Yeah, so people that are interested in connecting with me, if they want to email or reach out, they can find me at betterhealthguy.com. So betterhealthguy.com. There is a contact link there. My podcast is there. You can also find it on all of the, gazillions of podcast platforms that are out there now. I would say those are the 2 places, the website and the podcast. And again, if anybody has questions, feedback, other pieces, ideas, things I missed, something you thought fit in that I didn't talk about, that's how I learn and grow. I don't know everything. The more I learn, there's so much I don't know. So please feel free to reach out if I can help, or you just want to provide me with some new things to check out.
Absolutely. We'll be doing that and hope to have you back on in the future. Guys, we're going to wrap up because we have done a marathon here, not a sprint. But if you haven't been to the resource page at heavilymetalled.com yet, heavilymetalled.com, metalled is with 2 L's, has everything that you need. You sign up for the free email list and newsletter, you'll get a free symptom list and next steps allergy bundle. That can be really important. We are going to go further into that at a later date. You can link to all the podcast episodes there, which link to the guests. You can link to everything we've shared about. There's a resource page, all kinds of goodies and fun things there. And really important, there's a petition you can sign to share with medical providers and practitioners that ask them to pre-screen for metal hypersensitivity in hospital and surgical and office settings. This is more and more important. As the petition grows, my goal eventually is that everybody will be able to download a copy of this petition individually to take to their provider or facility, but it needs many, many more signatures. So if you would go sign your name and like and share that, that would be great. In the meantime, thank you, Scott, again for being here and being part of the effort to tell our bodies the medical establishment, and the world that we are advocating for changes across the board when it comes to metal implants, dietary and environmental changes, and we aren't going to take it anymore. Thanks for being with me here. I think this will be a great episode and a great resource as we do. Now, this is a new thing. Every time I do this, I get a really funny graphic and it starts putting laser beams behind my head.
I just saw that too.
Of
course. And I was like, how did you do that? Wow.
I don't know. Every time I've done this recently, it's done that. See?
But why?
But why?
I didn't do it. Maybe I don't do it right. I think this is for the blooper reel here.
Yes, so heavy metal blooper reel. That's going to be an awesome one. I could do that for some shorts, but this will be like a super compelling episode as I introduce some great new considerations to the listeners. I hope in sharing these episodes with each of our respective communities, and please do share, that we can bring many new epiphanies and paradigms to our listeners' continuing journeys to improve their health. Super excited for this. Super grateful for you taking a chance on a relative newbie and some new, less conventional concepts. Really great things are happening. And at some point, would like to discuss how I can further implement some of your knowledge into my upcoming course. It's going to be out soon. The rollout's delayed a few months. I got to learn to pace myself in all my exuberance, but I'm sure you know the feeling. And so we will close for now. Let's see if we can do this again.
Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware, and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetal.com, where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.